This is Janet Vale at the Rock Island County Health Department. Thank you for joining us. Today is October 8th and it's 3:30 p.m. Today we are going to be talking about critical infrastructure and specifically our transit systems and the precautions that they are taking in the time of COVID. But first, let's hear from Nita Ludwig and Ed Rivers talk about a case count. Nita, can you start us off, please?
Sure. Sadly, today we are reporting an additional death of a COVID-19 patient, a man in his 70s who had been hospitalized, has passed away. And we offer our deepest sympathies to the friends and family of this gentleman. In addition, we are reporting 36 new COVID-19 cases, which now makes our total 3,380. Currently, 23 people are hospitalized in Rock Island County, and the death toll is now at 88 for Rock Island County. Thank you.
In Scott County, the number of cases is 3,429 with 29 deaths.
Thank you, Ed and Nita. Now we're going to hear from Jennifer Hirsch. She is the Manager of Administration for MetroLINK. And following Jennifer, we will hear from John Powell, who is the Manager of Davenport Citibus. Jennifer, start us off, please.
Thank you, Janet. Thank you so much for inviting me here today to talk a little bit about how the MetroLINK team has responded to the COVID-19 pandemic. As you know, public transit is an essential service, not only for our community, but for our nation. And when the pandemic hit in late February, early March, our team had to really pivot and change and evolve the way that we provide transit service to the Illinois Quad Cities. So one of the very first responses we put into place was to add a second cleaning and disinfectant process to the nightly cleaning of our vehicles. So in addition to that deep cleaning that we see every night, we use an electrostatic sprayer to apply a tuberculocidal product on every vehicle. And then throughout the day, we're actually wiping down all those high-touch surfaces on buses when those buses pull into the terminals and wait for their connections. Our facilities are also disinfected continuously throughout the day, and we're using that same electrostatic sprayer to apply that tuberculocidal product to all of our facilities. And just recently, we've invested in a BioProtect antimicrobial product that once applied to surfaces continues to work for up to 30 days. We've worked really closely with our employees and helping them as they have been, working throughout this entire pandemic. So we worked early on with some outside vendors to secure PPE and hand sanitizers and disinfectant wipes for all of our employees, and we continue to hand those out to them on a regular basis. Our maintenance team has been very busy too throughout the summer. They were quick to come up with some creative solutions to install some plexiglass barriers on all of our buses to give some added protection to our drivers and their workspaces. We have three major transfer terminals located in East Moline, one in East Moline, one in Moline, and one in Rock Island. And so over the summer, we've made some pretty significant modifications to those terminals. We've put in automated flushometers, touchless faucets, touchless doors. We've installed plexiglass at all of our customer service counters, as well as hand sanitizing stations. And then with our vehicles, we actually have installed an air purification system on all of our vehicles for maximum air cleanliness, and the majority of our buses now have one automated wheelchair securement system that limits the operator-passenger contact. We knew that we needed to get the word out to our riders when this pandemic hit on what our expectation was of them, and then what we were doing as well to keep them safe. We didn't really have an option to shut down when the stay-at-home order was enacted because public transit, of course, is that essential service that's getting people to essential jobs and other essential services. So we worked really hard to let riders know that we were still running. Public transit was an option. You know, here's what we're doing to keep you safe, but here's what we're asking you to keep the ride safe. And we've been consistent in those messages of, you know, asking our riders to stay home, you know, wear that face mask if you're going to be riding the bus. And then, of course, letting them know what we're doing and all the cleaning protocols and other modifications that we've done to keep the ride safe. We had the opportunity to distribute over 3,000 what I call a ride safe kits to all of our riders. So those kits included a reusable face covering, a bottle of hand sanitizer, and a card that, again, just reinforced what those ride safe tips are for those riders. If you've seen one of our Metro buses out on the street lately, you may have noticed that the destination sign says Mask Up QC. Just trying to reinforce that message to the public, whether you're using transit or not, that it's very important to wear that face covering when you're out in public. So working with our National Trade Association, it's the American Public Transit Association, you know, they've conducted a number of surveys and research over the past 6 months to really better understand how COVID-19 has affected the riding public and public transit use. And they've really found through their research that, you know, what we're doing is the top priorities for the public. They just want to make sure their buses and trains are cleaned and disinfected and that agencies are working to keep their employees safe. But of course, the public also wants to know, you know, what their responsibility is when they're riding transit. And again, that's, you know, wearing your mask, staying home when you're sick, and following all of the health and safety guidelines that are out there. So we've done our own survey work too internally and found, of course, those same messages. So APTA has created a health and safety commitment program. We've pledged to sign on to that. In fact, we have signed on to it, as well as, you know, hundreds of other transit districts across the nation, you know, have signed on, committed to keeping public transit safe. I want to talk a little bit about our ridership. We have not fully recovered yet, but our hope is, as the public better understands the safety measures that we've put in place, we'll be able to continue to welcome them back to transit. Those who have returned to transit are using it to get to and from a job, and we know how important that is to the economic recovery of not only our community, but our nation. I wanted to quickly point out some other research that was done by Sam Schwartz Consulting, which is a global research firm, and they've found no correlation in the rise and fall of COVID-19 cases in the United States or across the globe associated with riding transit. And I really think it's because of all these safety measures that we've put in place, as well as a number of our peers across the nation. I want to lastly give a shout out to, you know, the real heroes of public transit, and those are our employees. Public transit does not have the option of shutting down, and especially when this pandemic hit, our employees came to work every day without hesitation. They are extremely committed to their jobs, extremely committed to their passengers and this community, so I want to thank them for everything they are doing. If you want to learn more about all of our efforts, check us out at Metro QC on our social pages. We have all of our videos up there, as well as a lot of the rider communications I've been talking about today. So thank you very much for having me here today, Janet.
Thank you. Thanks for joining us. Can you remind us what cities MetroLINK covers?
Yeah, we cover 8 cities in the Illinois side of the Quad Cities. So that would be Carbon Cliff, Kelowna, East Moline, Milan, Moline, Rock Island, Citibus.
Thank you so much. Okay, John, let's hear from you, please.
Let's see, you got me now, am I on?
Yes, we can see you and hear you.
All right. Well, I'll just say a ditto for much of the boilerplate stuff that Jennifer talked about. We're doing the same things in terms of the general approach towards trying to make sure that both our employees and our customers are clean. In the order that we did it, we first eliminated our fares to reduce the contact with fare media. We also provided gloves for all the drivers and provided them with the hand sanitizers. Of course, we had a problem initially, like many places had problems with getting masks. So we were a little late to the game on that. We did close our ground transportation center and we parked our buses on 2nd Street. And that followed the governor's proclamation in terms of keeping crowds away, crowds from gathering. We provided the towels and the Lysol wipes and provided educational material on COVID. Some of the things that we did a little different, maybe not, they may have done it also at MetroLINK, is our drivers were actually sharing rides when they were going on reliefs, when they were relieving trips at the middle of the day. We actually changed it so that they're each now in their own car. And that helped, I think, a big deal, both psychologically and practically, in making them feel a little better. We temporarily eliminated Sunday service, and then we assigned the drivers that were doing the Sunday service to actually help clean in the evenings when the buses came in. So we were adding to the cleaning that the maintenance department was already doing. As you all probably know, we finally permanently closed or canceled the Sunday service in July. We finally did get the masks to the drivers. We installed a plastic shower divider and required the customers to board from the back door. So that added a little bit of separation between the drivers and the customers. We also limited the number of passengers to 14. We rearranged the Citibus dispatch area to try to keep that clean in terms of the dispatchers. Each one now has their own area to work on. Thanks to MetroLINK, we actually manufactured a permanent polycarbonate barrier between the driver and the customers. We had ordered one and it was taking forever to get it. And we went over and visited the fine folks at MetroLINK and saw the brilliant job they did constructing their own barrier. And we came back and our mechanics actually utilized parts from some old buses in order to put together the barrier that the drivers now have. We are now requiring the customers to wear masks. And just this week, we started giving our drivers masks so that if there's a customer that needs the service, we do have a mask that that customer can use. We also are now requiring our drivers to wear masks at all times. We also purchased the electrostatic sprayers, and we are spraying the buses daily with disinfectant. We also purchased electronic ionic air purifying systems, but those are going to be installed. They have not been installed yet. We are in the process of purchasing contactless faucets, contactless toilets. I didn't think about the contactless door until Jennifer just mentioned it, so that may be something we look at. And finally, we are in the process of purchasing the contactless wheelchair and scooter securement system that Jennifer referred to. So those are all the efforts that we've made. Our ridership, we've lost about 40% of our ridership. It's been pretty constant. From the beginning of the COVID to now, we're about at 60% of our normal ridership. And we've only had one incident with a driver that had COVID, and we're pretty sure the driver didn't get the COVID at work. So we feel very good that the steps that we've taken have protected our employees during this pandemic. That in a nutshell is what we've done.
Thank you, both John and Jennifer, for your talking points today. We have a couple of questions that we'll start, and any reporter who wants to put something in the chat, go right ahead. For both health departments. Ed, how's contact tracing efforts going?
Well, our case investigators are very busy with the increase in cases and the increase in the rate of the cases, but they are hanging in there and getting the job done.
Okay. Nita, same question. How's contact tracing going?
Sure. Well, they are very busy here in Rock Island County too, with our numbers being what they are. And actually, that total number that we give every day is the total number of positive cases. But the contact tracers also follow all the close contacts of those people. And so you can really multiply that by about 4 or 5, because hardly anybody doesn't have at least 1 or 2 close contacts with this whole situation. So we have hired, in addition to our regular infectious disease staff, we have hired a total of 14 contact tracers to help us in this. And they are not all full-time, but we have just hired 3 new ones that are full-time. So that'll help us get back on top of all the cases we've been having. One started today. Today is her first day. And then we do have 2 additional people starting in the next week or 2.
Okay. What are the contact tracers seeing? Are infections being traced to community spread, or are we seeing any other trends? Nita, what do you think?
I guess I'll go first on that one. So we do see a lot of community spread within households. We see a lot of, one parent is positive, and then a couple of days later, the other parent is positive, and then maybe a few days later, a child or 2. So it is very difficult, I think, to isolate in the same household and not have the other people in the household get it. So when you do find out you're positive, it is super important to try to isolate yourself from the other family members however you can. Make sure that you're cleaning and disinfecting all those commonly touched surfaces. And even if you have to be near the other family members, make sure you're wearing your face coverings as well.
Ed, same question to you. What trends are you seeing with your contact tracers?
I'd like to emphasize what Nita closed with. Wear your face coverings when you're in public or around other people. We mentioned a study out of Springfield, Missouri on the Tuesday press briefing where 2 stylists at a salon were both positive for COVID, and they performed services for well over 100 individuals. All the people in this case were masked, and there were no infections that resulted from these services being delivered. And in a salon, you're at very close quarters, usually for over 15 minutes. We know that there are people who are having gatherings or going to public places not wearing masks, and you're putting yourself and others at risk when you do that. So please wear a mask when you're in public or gathering with other people. And by the way, get your flu shot.
Thank you, Ed. That's a great reminder. We are in flu season too. Jennifer, do you have an idea of how many riders you lost?
Yeah, so when the pandemic first hit, we lost probably half of our ridership. So 10,000 riders a day down to 5,000. We've gained back probably about 20% of that. What we're missing right now is a lot of the students who use public transit to get to and from school. With school having a lot of remote learning, we're not, of course, seeing those students use transit, but we're slowly starting to see folks get back to work and get back on the bus.
Okay. While I have you, do you have any mask up designs that you can share with us? If you can email them to me, I can send them out to the media.
Yeah, I think the question was a photo of the bus saying mask up QC. Yes, I do have one, and I'm happy to share that with Janet to send out to everyone.
Okay. So when I send out the after briefing release, watch for that then. Thank you. John, do you have an idea about your ridership numbers?
We carry about 650,000 people a year. We probably lost 200 to 250,000 on a yearly basis. We haven't lost that, obviously, because the COVID's only been since March. Like Jennifer, we're not getting a lot of students. So that's a big part of our ridership during the fall and the spring and the winter. And we're not picking up many students at all compared to what we normally do. So the impact may be somewhere in the 250 range by the time 12 months goes by.
Thank you. Can you remind us, does Citibus cover only Davenport, or do you offer services in any other city?
Well, we touch Bettendorf, we touch Rock Island, and we touch Moline.
Okay.
We
Thank
run
you.
service in all those areas. And Jennifer, just sort of a light bulb went off when I was listening to her. We also have a number of advertisers on the sides of our buses that have put ads in during this time, reminding people to wash their hands or wear a mask or something like that. So that's also been an additional thing that's been done locally, and that's been done by the advertisers, not us.
Okay, thank you. What have the transit systems done specifically to get riders to election polling sites? John, do you want to start with that?
I don't know that we have done anything or are planning to do anything specifically, but you bring up a very interesting idea. What we may be able to do, and I'll pass it on to the higher ups, is think about just running free fares for the day. And I have a feeling we did that last year, but I don't remember.
Okay.
But I think that's an interesting idea, and it wouldn't, I mean, we wouldn't lose much revenue. I will
Okay.
make that note.
Same question, Jennifer, about election day bus services.
Right, so transportation, I know, can be a challenge for folks who are wanting to get to the polls. But our service area, when you take a look at our entire route structure, we have a pretty extensive route structure in place. So you can find a bus route located, you know, probably within a block of your home that you can catch to then take the bus to a polling place. We run, start very early in the morning. My first bus is out on the street about 4:30 a.m. And run well into the evening. So we cover that entire polling hour time frame. So public transit is a great option for those who do not have transportation and can get to the polls.
Okay, well, thank you so much. That is the end of the questions that are in the chat. Let's pause for a few seconds here if anyone wants to add any additional questions. John, there's a request for Citibus photos also to be sent if you have those, the signage that you were talking about. If you can email that to me, then I can send it out.
Will do.
Thank you. Okay, well, I see no other questions. I thank you for joining us. This is our last scheduled briefing of the week. We expect to come back to you on Tuesday. Have a nice weekend, everyone.